Did you know that if your blood pressure drops too low, it can become dangerous? For most adults, a normal blood pressure is below 120 over 80 millimeters of mercury. But when it falls below 90 over 60 millimeters of mercury, it's considered low. However, factors like hormones, pregnancy, and overall heart health can affect blood pressure differently in men and women. For example, women may be more likely to experience symptoms of low blood pressure, like dizziness and fainting, especially during pregnancy or hormonal changes. In this video, we'll dive into the causes of low blood pressure and how it specifically affects women. Stay tuned. Blood pressure is simply the force of blood pushing against your artery walls as your heart pumps. It's usually measured in two numbers. The top number, known as systolic pressure, measures the force of blood when your heart beats. The bottom number, called diastolic pressure, indicates the pressure when your heart is at rest between beats. Both numbers are recorded in millimeters of mercury. Some people naturally have low blood pressure, and it's not a problem for them. But for others, a sudden drop in blood pressure could signal an underlying health issue. And that's where things get dangerous. When your blood pressure is too low, your heart, brain, and other vital organs may not get enough oxygen and nutrients. This can lead to dizziness, fainting, and even serious complications like heart attacks or strokes. So what causes low blood pressure? One common cause of low blood pressure is orthostatic hypotension, also known as postural hypotension. This happens when your blood pressure suddenly drops after standing up from a sitting or lying position. It can be triggered by dehydration, prolonged bed rest, pregnancy, certain medical conditions, or even some medications. While anyone can experience it, it's especially common in older adults. Another cause of low blood pressure is postprandial hypotension, a drop in blood pressure that happens about 1 to 2 hours after eating. It's more common in older adults, especially those with high blood pressure or conditions like Parkinson's disease. Then there's neurally mediated hypotension, which causes a drop in blood pressure after standing for long periods. It primarily affects young adults and children, and is believed to result from a communication issue between the heart and brain. Other causes of low blood pressure include significant blood loss from an injury leading to a sudden drop, diabetes, which can affect circulation, and heart problems, like arrhythmias, which disrupt normal blood flow. For many people, low blood pressure goes unnoticed. However, others may experience symptoms such as confusion, dizziness or lightheadedness, fainting, fatigue, blurry vision, headaches, neck or back pain, nausea, or heart palpitations. And what about pregnancy? Can low blood pressure be a concern during this time? Pregnant women can experience both low and high blood pressure. Low blood pressure is especially common in early pregnancy, particularly for those struggling with severe morning sickness or difficulty eating. While it's usually not a major concern and can be managed with rest and lifestyle changes, it's important to see a doctor if dizziness or fainting occurs, as that could signal something more serious. In some cases, low blood pressure can be a warning sign of an underlying condition, especially if it drops suddenly or comes with symptoms. Even a small drop, just 20 millimeters of mercury, can cause dizziness or fainting, which can be dangerous. Generally, blood pressure below 90 over 60 millimeters of mercury is considered dangerously low, but some people may still feel symptoms even at higher levels. If you don't have symptoms, you may not need treatment. But if symptoms do occur, managing them could involve drinking more fluids to stay hydrated, adjusting medications that lower blood pressure, or even taking medications to help raise it. Your doctor might also recommend lifestyle changes, such as modifying your diet, being mindful of how you sit and stand, or wearing compression stockings if you spend long periods standing. By understanding the causes and symptoms of low blood pressure, you can take steps to manage it and protect your health. If you found this video helpful, don't forget to subscribe to Blood Pressure Healthcare for more tips on maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.